welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues. Well, viewers, recently a virus has created a fierce psychosis among everyone, as that had led to health hazards in many. Yes, we are talking about Nipah virus. This infection is a newly emerging zoonosis that causes severe diseases in both animals and humans as well. And to discuss more on this topic, today I am joined by Dr. Prakritish Bora, who is a well-known pediatrician. So not to waste any more time, I'll straight away move to him and talk about Nipah virus, which is very prevalent nowadays. So Doctor, welcome to Good Life, the health show once again. It's a privilege to have you in our show, Doctor.
Thank you.
So today we have taken the topic which is a talk of the town and everyone is having a confusion. So what exactly it is? So the topic is Nipah virus. So what is Nipah virus, Doctor?
It's an RNA virus, like any other virus.
Okay.
But then this is a newly detected, relatively newly detected virus. Although the recent outbreak in Kerala has brought it to the limelight. And the basic reason is because of the mortality, the huge mortality this virus can cause, which is up to the tune of 50 to 75%.
Oh my God!
Of people affected can get actually die out of this disease. And as you probably know, that the first outbreak was actually detected in the year 2001 in the district of Siliguri. Then there was another epidemic which was maybe a smaller one in the year 2007, followed by May 2018. And this virus has been named after a village in Malaysia, where it was first isolated in the year 1998 and 1999. So Malaysia, Singapore, then Bangladesh. These are the places where this virus has been, spreading the illness. And it's a zoonotic disease, as we know. Zoonotic basically means coming from an animal or a bird, and it comes to human. But human to human transmission is also possible by close contact and contact with body fluids. And Nipah virus basically transmits by air, so which means close contact with anybody can lead to disease in another person, and also through body fluids and tissue. And the current epidemic that we saw in Kerala was mainly through bats.
Mainly through bats.
Mainly through bats. And the intermediate hosts are usually the commonest being pigs. So people who deal with pigs are at risk. Then some of them have also reported from horses and other animals. But commonest being bat, followed by pigs.
So basically it is transmitted through animals, and we have to be very careful if someone is in a direct contact with animals, like if they are in a stay or something like that, they are walking out. So what are the basic symptoms of Nipah virus, Doctor?
See, it has two kinds of manifestation. Like any other viral infection, it will lead to high grade fever. Then some people will have respiratory symptoms in terms of coughing, high grade fever, dehydration, and followed by difficulty in breathing, which basically indicates someone having something called acute respiratory distress syndrome, ARDS, a pneumonia-like presentation. And then it can also lead to swelling in the brain.
Swelling in the brain?
Swelling in the brain, which is known as encephalitis, wherein the person will be having headache because the virus has gone to your head, and uneasiness, and slowly the person may get into coma. So typical encephalitis like presentation, like we see in Japanese encephalitis in this part of the country. So it is kind of similar to that. So what I am trying to say here is the symptoms are pretty non-specific. It doesn't
non-specific and very common.
Very common, yes. You can see it in so many other conditions. So unless we have a very high index of suspicion, this disease may be missed. So in an epidemic situation like we had in Kerala, this disease has to be kept in mind all the time. Anybody coming with fever, this has to be kept in mind. So the only way of diagnosing on time is keeping a high index of suspicion in all cases. Like in the current scenario in Kerala, this virus first infected two brothers, siblings basically, Muhammad, I think Silah or some person.
Two brothers from the
Two
same
brothers,
family.
same family, and they managed to. I mean, about 2,000 people, about 1,900 people came into contact with these people while treating them, and family members, friends, and people near that village. So I think this village was in somewhere in Kozhikode, and government of Kerala did a fantastic job in containing disease on time. Because
there was also a report of a nurse who died while treating.
Exactly. So there were a lot of about 1,900 people for whom there is a alert by the government to keep a track or check on their health, so that the disease doesn't come onto them. And the mortality in fact has gone up to I think 17.
Okay.
And the disease number probably is about nearing about 50.
So first and foremost, like what a person has to take care of, like if he or she is suffering from fever and they think that this fever might be a normal kind of, but they have to have a check. If the fever goes for 2 to 3 days, if it extends, then they have to go and see a doctor, isn't it?
Yeah, high grade fever and similar symptoms in the state of Kerala would definitely require testing for Nipah virus.
Okay.
But rest of the states, since it has not come in that way, so we did not really worry so much for Nipah virus. And only way to contain the virus is the treatment is not an option, because 75 the state of Kerala had a mortality of 70%. Out of every 10 people, 7 died.
Okay.
So it's a huge mortality.
Huge mortality.
So you can't really have the disease and get treated. So that is not an option. The option is to keep it away.
Keep it away.
By prevention.
Okay.
So since we know how it comes, so only thing we need to do is take care of ourselves. Like in the state of Kerala, people who drank
there will be lots of preventions also, isn't it?
Yeah, no, that's what I'm trying to tell you. This date palm sap, it's a kind of a khajur.
Khajur,
yeah. That the fluid and the sweet fluid that comes out of tree of the khajur trees, some people they trap it in open containers and drink it from there raw.
Okay.
So and the bats normally like to eat this. They are called sweet bats, bats, and they like to feed on this date palm sap.
Okay.
And people who drink sap from this trees will get infected.
Okay.
So avoiding this kind of sweet drinks, avoiding fruits that bats will normally eat, like mangoes and lychees, half-eaten fruits should be avoided.
Almost half of the fruits will have to be avoided these days, because like it's been transmitted by bats, so it is very much possible that like bats might have contaminated on those cattle.
But a fruit which is totally intact, has not been eaten by a bat, that fruit is unlikely to give you the disease.
Okay.
So proper selection of fruits is important. I am not saying you have to avoid fruits altogether, but then contaminated fruits should be avoided.
Okay.
That is one way. And people who deal with pigs, they will have to be very careful, like in handling the pigs. Any ill pig should be taken as infected with Nipah virus unless proved otherwise.
Okay.
So those people, and the other group of people who are at risk are people like us, I mean basically healthcare professionals. We have to use proper universal barrier techniques while dealing with anybody who has suffered from Nipah, so that we do not infect ourselves. Proper wearing of gloves, caps, gowns, and there has to be entire barrier while treating these people.
Okay, because you are very close to the patient and you have to treat them, because that's your job. So in that kind of thing, you have to be very careful because of your health issues also. So you have to have a proper gloves, you have to have a proper hygiene maintenance as well. So other things, what do you have to take care of?
I think this is about it. Basically, fruits, bats, pigs, and human contacts you have to avoid. And Besides this, I don't think at this point we do not have a vaccine against this virus. So this is still under consideration. And one point is that since only the third world countries have been affected, the Western world is still away from this disease, and so the amount of research that would have otherwise gone into a disease has not really been done. So we do not know certain things like how long a person who gets infected can infect other person.
Okay.
So we do not know this time period, time frame of a person that has to be.
Still, many facts are unknown. Actually,
unknown, exactly.
Okay.
So we know that once a person gets infected, it takes about 5 to 14 days.
5 to 14 days.
14 days for this person to show some symptoms.
Okay.
So that is one thing we know. And another thing that Kerala experience has given us is probably the period of infection. A person who will become infected for other people is only during the acute phase of the disease.
Okay.
Acute phase means when the patient is having high fever, cough, or he has some brain related symptoms. That acute phase is the time when he will infect other people also.
Okay.
So that is one thing probably we have learned from the Kerala experience, but we are not absolutely sure how long a person will actually, in terms of surety, 100% surety, will be infective to other people.
Okay.
That thing.
So as you have already mentioned that it will be in an acute case of virus only, they can be cleared. So how does this virus spread to person?
It's a airborne disease, so just close contact will be good enough.
Okay.
And of course, contact with body fluids is another way, because it comes in the urine, it comes in saliva. So any kind of body fluid will infect the other person. Close contact and tissue. Suppose, especially, it is basically for medical healthcare professionals, because they come into tissues of this kind of people, and while handling them, we have to be careful.
Okay, doctor. And doctor, this is a virus, like when this virus spread it out, and you all were very curious to know what kind of virus it is. So what kind of study do you do when these kind of viruses news come up to you? And Nipah virus is such kind of virus where like everyone is so confused, like because things have been said, you can't have a fruit, you have to be very cautious. So parents, they tell their children not to go for fruits, or they are very cautious about these things. So what do you want to tell to the parents and what do you want to tell to the viewers out there?
No, we don't have to stop eating fruits. What I am trying to tell you is that contaminated fruits. Contaminated fruits means fruits which have been tampered with, broken or eaten by unknown person. So unless a fruit is wholesome, it is unlikely to be infected by a infected bat. So bats are the ways how we will get an infected fruit coming to our house. So if we are good in selecting fruits, we don't have to worry. And cleaning the fruit properly in hot water and scaling the top of the fruit is also important in reducing the possibility of infection.
Okay.
And that is what we can tell about people from while eating fruits. And rest of the things, one has to be careful in coming into contact with people who have high grade fever in an epidemic situation. So one should avoid. And besides that, I don't think there is any other precaution that we can actually take.
Okay, so these are the things, these are the basic things, because it's still unknown. There are many facts to be known, and you're still, I think, studying on the entire virus thing, isn't it?
Right.
So what more you want to add, doctor? What more things you want to tell to the viewers, how to take care of? Preventions you have already mentioned. There are certain basic preventions we can make it out at home itself. So what more you want to add?
Hygiene is the most important thing, not eating raw, unclean fruits, being careful while traveling. And taking medical help as soon as possible for any disease where there is high grade fever, headache, coughing. One should be prompt in getting medical help. Although we do not have a definite treatment for Nipah virus, but recent experience has shown that our antiviral agent ribavirin can reduce the amount of days with fever, and it can also reduce the possibility of complications, like your brain getting infected. So that can be avoided or prevented to some extent by the antiviral drug called ribavirin. So that was tried this time. Besides that, we do not really have much to do except for supportive care. Good hydration, so that a person doesn't get hydrated, so adequate fluid intake to support the respiratory system. We have to be on the medical care. Oxygen has to be given on time. And if a person brain gets swollen, then anti-edema measures to reduce swelling of the brain. But all this can be done only in the hospital.
Only in the hospital.
Not at house.
Okay,
Yeah,
not at the. Only the basic thing, if suppose someone is contaminated to fever, then one has to go and see a doctor. Then otherwise, as you have already mentioned, these things can be done only in a hospital.
Right.
Because ourselves, we can just prevent us from not having those kind of fruits which are already being contaminated by bats. So we have to be very choosy while buying fruits as well, isn't it?
Right.
So what kind of diet one has to be, one has to take care of if someone or the other are having these kind of symptoms in there?
See, there is nothing specific. Like all other diseases, when you have a disease, you should be eating very healthy diet, fruits, vegetables, meat products, then milk products, food which will give you a basically wholesome diet,
Okay.
and adequate amount of fluids. That is very important, because any kind of fever will lead to loss of water and electrolytes from your body. So a good amount of fluids, like any other diseases, that is the norm. There is no specific diet that we have to follow because you have the risk of getting Nipah virus. There is no specific diet for that.
Oh, there is no specific diet. It's the same thing actually. So doctor, is there any kind of patient have come up to you with the confusion that, because they might be scared when their news was breaked out. So is there any kind of patient came up to you and they were like very worried about this Nipah virus, and suppose the person is also suffering from fever, so you gave them consultation that no, nothing such has happened or something like that?
As I said, even I am very new to this. I have not had the chance to treat anybody with Nipah virus.
Okay.
So I would consider myself fortunate, because Kerala government was very prompt and good in controlling the virus to their state only, and a few districts. So they did a very marvelous job in doing that. So yes, people have been confused and they wanted to know what is it, and since even the medical fraternity doesn't have much knowledge about this virus, so the basic things we told our patients not to worry, as long as it has not come to Guwahati, Assam, or northeastern India, it has not come. So there is nothing really to get so much worried about. But then this talk that I thought should handle this topic, so that there is no fear among people now, because it has been contained in the month of May, and June the outbreak has been taken well within control. So hopefully this virus will not spread to our part of the country.
Okay. So doctor, on last note, what would you like to tell the viewers out there, that what kind of confusions they are having in their minds, so what they have to do, and they need not to worry, because this thing will be prevalent, but we have to take an extra care of everything. So what do you want to tell the viewers?
See, for the viewers, I have the information that I would like to give will be, be careful while eating fruits. But then don't stop eating fruits, because fruits are needed for our
very
health.
Important.
Yeah, we have already talked about that. And at this point of time, it's good that we have come to know about this virus. Even though the information is still limited, or we are not in good understanding of this virus, still we know to some extent what kind of disease this virus causes. So at this point, the information that we have is that it is a virus which can lead to fatality up to the tune of 75%. So which is a high mortality disease.
Okay.
So the best option that we have is to prevent it by being aware about this virus, and we have to know the things what to do when an epidemic situation occurs. Suppose it occurs tomorrow, or God forbid it occurs in this part of the country, we have to be aware about this disease. By being aware, we can really prevent this disease from spreading out.
We can take these early precautions as well, and if we have any confusion, doctors like you are always there to help us out and give us more consultations on the things and the confusions we have in our mind, isn't it, doctor?
Yeah, right.
Okay, so thank you so much, doctor, for coming to our show. It was valuable inputs which you gave us on Nipah virus, a confusion which was prevalent in everybody's mind, and they were actually stopped eating fruits. So I think after your show which we'll be showing to them, and they'll be understanding the views that Nipah virus is a virus, and thankfully we have come to know about the virus, but this viruses can be dealt up, isn't it?
Yeah.
I hope the study is still unlimited, because it's limited, and we are already on the study. So the study is still going on, so how much time, and you are also in touch with the Kerala government and Kerala medical department as well, isn't it, doctor?
Right.
So what are they saying, and what more studies are being required to do it?
See, for any viral disease, the first and foremost is to come up with a vaccine, because viruses do not have treatment. So the best thing that we can actually do for our people will be to develop a vaccine which will prevent this virus from coming.
Most important.
Right, like we developed Japanese encephalitis vaccine, and that is how the government was able to contain Japanese encephalitis, like the epidemics that we used to have a few years back,
Right.
has really come down now because of the vaccine. So the vaccine will probably give us a proper solution to this disease.
Okay, vaccine is the only solution which can be given. So things are working out and people are discussing on it.
Right.
So thank you, doctor, for coming to our show. It
Thank
was
you so
privileged
much.
to have you in our show. So that was Dr. Prakritish Bora. It was great talking to him. He was talking about the Nipah virus, which has created a fear psychosis among people as well. And you need not to worry, because confusions are there, what you have to do and what not to do. But he was here to guide us to the entire episode about Nipah virus, the symptoms, the prevention. So the basic thing is that we have to prevent ourselves for things we should not do. And if you have any confusions, then you can always see to the doctors and they can clear out your confusions and give you a proper consultation. On that note, we have to slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You are still watching Good Life, the health show with me, Pooja. Well, now it's time to move on to a subject which plays a very crucial role in our lives. In order for our bodies to function properly and stay healthy, it is very important that we follow a good nutritious diet. And to discuss on proper food habits to be taken, we have with us the nutrition expert Nipah Baby Bora, who will enlighten us on how proper diet in our daily life is of great significance. So Nipah, once again, welcome to our show, and you are here to guide us what kind of diet should be taken up. But today we have taken up the topic is complementary feeding. So first of all, you please discuss and you please enlighten us on what is complementary feeding and what the viewers have to know about it.
Complementary feeding actually starts after the 6th month of the baby.
Okay.
Usually we have seen some of the parents, they do not know when to start the complementary feeding. They have some ritual programs and all these things, and then they delay on to start the weaning or the complementary feeding. But at the other side, if they delay on the process of weaning, then what will happen, the child will delay in getting some proper nutrition,
Okay.
like energy and protein, because after 6 months they require more of energy, protein, as well as like zinc and iron is equally important, and some of the vitamins. So that has to be again plays a very important role. So as soon as the baby is at 6 months, we should start weaning or like complementary feeding. From 6 to 9 months, we have to give babies like fully mashed type of food, but the consistency has to be maintained. It should be very thin, and the frequency of the feeding should be in a very quick interval, like frequency should be more, but the amount should be less, like maybe of 50 gram. And if the baby is not particularly, they may not have the food in that, when the mother start feeding, one thing we have observed that they split from the side of the mouth, because they do not know how to swallow, because they know how to suck. Then after that, slowly they will start learning the process of swallowing. So so the mother should not worry actually, splitting of the food when they start like weaning.
Right. So this is actually the natural thing, and one has to start it in a very early stage, isn't it?
Right.
So that they can have a habituate of things of everything. Like you said, it becomes like food, they are having it and they don't know how to swallow it. So these are the things they will learn quickly, isn't it? So what more you want to add to it?
I would like to add with that, like the food should have variety. Variety
Yes.
should always be there. It's the same kind of food is given to the baby. Obviously, they will not like the taste, or may they become bored of having it, and the mother should not force a particular food. If they do not like suppose rice puree, that rice can be modified to some other form and can be fed to the baby. Usually you should start with the purees like rice puree, squash purees can be prepared, and to increase the energy dense, little bit of butter and ghee can be incorporated with those kind of feeds. And mostly the mother should stick with the homemade food products, more than going for some formula foods which are available in the market, but that can be prepared at home also. Rice can be grinded, and then dal can be grind with. After that, rice and moong dal can be added together with that, like sesame, that til can be cleaned, and you can add that sesame like half teaspoon, half teaspoon with that, and then can we make a porridge by adding formula milk in that, in fact, and that can be fed, because sesame contain iron intake is more in sesame. And usually if the baby do not have any kind of allergy from the nuts, then they can grind some of the like kaju and almonds, that can be grinded and kept and stored in a very clean container, and when they prepare the porridge or khichdi, they can add that half teaspoon or 1 teaspoon, gradually the amount should be increased. So that one will give them protein also, as well as the iron content is also more in that. And as I told, zinc is also very important in this particular age, because we have seen some of the baby or the child feel sick very frequently, because of like the immune system may not be strong enough to protect themselves from certain kinds of diseases and maybe from the infections. So to boost up their immune system, it is very important to have like zinc rich diet or zinc rich foods. So zinc is available in the pumpkin, and it is also available in squashes, and like that pulses, pulses like maybe green moong, and then green peas, legumes like, and then kidney beans and all contain a huge amount of zinc. So that can be given to the child of this age, but usually I have seen parents, they do not give, like they say that if they provide giving like legumes, the stool will be more, or some sort of like queries they come with that, but
everyone have their own thoughts,
actually in that way. But in a very early age, when you start giving one particular food, obviously the baby not be able to tolerate, or maybe the frequency of the stool may be more at that time, but that should not be worried for it. Maybe
because that will be for some time.
That may be for the some time. But one thing also we have to see, that if after giving the particular food, if the baby is not able to tolerate, that means they have to go and see a pediatrician, a doctor, because from that particular food item maybe they have some allergy, or maybe they are not able to tolerate. So that also has to be noticed while you start giving first feed to the baby.
If it is going for a long time, then of course they'll have to go see a pediatrician, and they'll get an understanding that this food is not good for your child. Then they'll immediately stop doing that.
And at this stage also the vitamin A plays a very, very crucial role. So in this aspect, all like colored vegetables, maybe yellow, and mostly the yellow and red vegetables contain ample amount of carotenoids, which is useful for the eyesight too. And so in that aspect, like grated carrots, beets can be added with the while preparing khichris, and they can prepare some halwa also at home. But one thing is should be that they should not prepare with the cow milk. That is another thing. Usually they make a mistake. Before attending the age of 2 years, they start, some of the people they are not aware of it, and they start giving the cow milk, which may be again not be able to tolerate by the infants or the children of below 2 years, because milk protein which is present in the cow milk is not able for them to digest at that particular age. So after 2 years it is better under the observation of the doctor, if they start, it is in a better side. And then they can start giving after 6 months, they can start giving the egg yolk, egg yolk, and after 1 year they can start giving the whole egg.
So Tina, if we talk about the quantity, what would be the proper quantity for a child to be given this kind of food, mashed food, and how a mother will come to know? So they'll have to go see a pediatrician or any of the nutritionists, or at home only they can make out that while I'm feeding my child, so she is like done with it. So what kind of quantity and how she will make out the quantity to be given to the child?
At first, when they start weaning,
at the initial stage,
in the very initial stage, it should be always marked, no, that the feed should not be very, as I mentioned already, the feed should not be too much of thick. The texture and the consistency plays a very important role. So at the very starting, the texture has to be very, very smooth. And when you mash the thing, there should not be any kind of peel and all these things. No, they won't be able to digest. And the other thing is that the consistency should be very thin, and the frequency should be less, but the amount should be this one. Yeah.
So this kind of like things, they can be taken up at home itself, and they don't have to like consult. But if they want to consult a nutritionist, then they can go and easily consult. But we have seen that many, they follow their elderly people and the elderly people at home, and they give them suggestions to go for this food for their child, because they see their grandchildren to have a good health out there. So they also apply some ghee, some butter. So are these items also good for their health as well?
Yeah, this is you can give, because it is, as I said, that energy.
But a proper
dense,
amount maybe.
Yeah, a proper amount. If the amount is more, obviously the baby won't be able to tolerate it. So the amount always matters. The amount should be less, but you can add in every feeds that you are giving, and the variety should always be maintained. And in terms of like fruits and all, you can start with like mashed banana, and then papayas can be mashed, and you can feed the
Okay. And what are the problems faced during this complementary feeding, Tina?
Mostly the mothers are, they can give complaining that the baby do not like taking the food, or they always keep crying when they feed. This type of things comes up. So as they should make actually a routine. If Monday, if they are giving a puree, then Tuesday you make it the same things can be cooked in some other forms.
So can be modified a bit.
Yeah, modified a bit. So in thereby the taste will also be changed, and also you have to, you have to keep when they start feeding the child, you have to ensure that the child is hungry. If you overfeed the child, obviously
we have actually seen that in many of the mothers. They actually they forcefully feed their children, and if suppose they are done also, they are crying, there might be they are thinking that no, they have to have more. So in that case of time, what do you have to tell to the mothers out there?
That if your baby is not feeling like eating, that time you play with them. You play with them for some time, and make them feel that that they are hungry, and after that only you start feeding them. Do not force for a particular food. If they are not liking the food, suppose a baby do not like potato, do not force him to take the potato. Just changed for some other day. That potato can be given in some other form. It can be mashed with butter, or you can just grate while you prepare the khichdi and all. So that can be incorporated along with other food items and can be given.
And for a new mother, it's very in a confused state, that she or she's very confused like what kind of food should be given to their children, like when they have to start this complementary feeding. So in that case of time, if suppose there are grandparents or their elderly people at home, then it's fine, they can get a consultation. But if no one is there and she is a single mother at home, so how she can just take care of their children, and they have to go to a nutritionist to get a consultation. But not everyone goes and sees a nutritionist, isn't it? So on that case, what you want to give a consolation to the mothers out there?
I would like to tell that do not delay in weaning.
Okay.
So because if once you keep delaying, then obviously the nutrients that required by the child will not be able to get, and your child will fall sick, or their growth and development may not be proper, because after 6 months they required more of vitamins, more of like iron, as I told, zinc, vitamin A. So those things will only be able to have when you start complementary feeding. This is one thing. And another is that when you start complementary feeding, first you have to start with mashed things, like vegetable mashed or like potato mashed. Okay, no doubt you can use over there like ghee and butter on that, and then slowly and gradually you increase the amount when they attain the
thickness,
yes,
everything.
yeah, right. So do not worry when you start feeding, if they split out or if they do not want to take it, but keep giving them because they will learn.
They will learn actually.
Yeah, right. And another thing that has to be taught to the children, because they do not know actually the taste of whether it is sweet or whether it is salted.
Absolutely.
Because that sweet or salted taste is given by the parents only in the very initial stage. When if you start feeding them with too much of salted, their taste will become in that way. And if you keep
they will
feeding,
need that again in the next
right.
time.
And if you give them too much of sugary items, their taste will become in that manner.
So it should be balanced.
It should be balanced. You should not give too much of refined sugar, and also the salt intake should be balanced. You should not feed them too much of raw salt or the salt that you use while preparing food. For a child below 1 year, the salt should be very, very minimum.
And suppose if a child is suffering from diarrhea, because we have seen these kind of instances and diseases amongst the children when they are very young infant. So what kind of like precautions a mother has to take, and what kind of diet at that time should be given to that children?
Yeah, in that stage, you can like a home remedy, as we all know, they can be given like a banana, and then if it is possible, you can give like coconut water. That is also good because it contains potassium, and also you can mash some of the some kind of like rice and pulses, dal water that can be prepared by like moong dal and rice can be cooked together, and then you grind it in a mixture grinder, and then you stain it. So that that watery part, or you can say soup, can be fed to them, which will give them energy as well as protein to them, and dehydration will not be there because like water will be added while preparing the soup.
Okay. And Tina, like we are talking about the feeding practices, and also we are talking about the complementary feeding. So mothers out there are very confused sometimes, like they are very confused and they are very scared sometimes because they have to take care of their children, and they are very cautious about the health of their children as well. So in that point of time, what kind of tips you can give to those new mothers out there?
Well, one thing you have to always remember when you start preparing the complementary feeding, the hygiene has to be maintained.
Okay.
The mother should wash their hand. The utensils should be very, very clean, because you are giving your child that time sometime outside foods. So those should be cleaned properly and washed thoroughly, and then you should cooked properly. So it should not be uncooked. Uncooked food should not be given to them. That has to be look into it. And after that, as I told, that feeding should be you should start gradually increasing the consistency, and after 9 months you can start giving them chopped vegetables while preparing the khichdi or porridges. And after that, you can add some while preparing porridge, you can add some apple and all these things. Also apple stews can be given to them. And the nuts powdered, as I told, it will enhance the iron content, and also it will increase the protein content. So that can be prepared and kept in a clean container. And attending the age of like 1 year, they can give some like this dalia and oats can also be given to them. But one thing you have, while you cook, it should be very soft, or otherwise you can grind the oats and you can keep it, and after that, that grinded oats again can be prepared in the form of porridge. And while you prepare the porridge, you can add over there like some grated apple. The flavor will be different. The other day you add some nuts powder, again the flavor will be different. Some other day you can chop some banana and then you can give. So in that way the variations will
be given, and child will like it more as well. So Tina, you have come across many of the mothers in your clinic. So what kind of confusions they come to you, and what are the common confusions they come up to you that my child, I have to give what or what not to give? So how you deal with them? What kind of counseling do you give to them?
Actually, when they come to me, I take the history of them, what you actually
That's
give
very
at
important
home.
actually.
What you give at home and what is the time period. Sometime I have seen mother, just before giving the major meal, they will make the child to eat like snack type of things, or like they will overfeed the child, and after that they will say my child is not taking. That has to be noted. Before, like, the time should be maintained properly. If you are feeding your child in the morning, like proper breakfast timing should be maintained. So if you are feeding the child, you make a schedule of it, like early morning when he gets up, so you can give some kind of formula milk with that, and with that you can prepare some kind of porridges, and you can give. After that you can give some rice based things, and then later on you can give some mashed maybe vegetables, or maybe mashed fruits and all can be given. Then again in the afternoon you prepare the khichdi. While you prepare khichdi, it should not be only with the rice and moong dal. Basically our people have a
we have
tendency of always
actually.
like giving
Khichdi,
rice and
dal.
moong dal.
Moong dal.
Yeah, rice and moong dal. But that dal can be again changed, as I told you, that it can be prepared with green peas also, and it can be prepared with kidney beans sometime, but the peel should be removed.
Of course.
Yeah, the peel should be removed, and it should be mashed properly, so that the baby can swallow it without having any hindrance. And the feeding should be in a very slow mode. It should not be like,
yeah, in a very
given.
hurry.
Right.
Suppose
Hurry
if you are
burry.
also very hurry, and
Yeah.
if you have to go to office, still you have to be very patient
Patience,
with your
right. This is
child
very
as well.
important. When
That's
you
what.
start feeding, they will make the entire thing very dirty.
Messy,
But
yes,
yeah,
yes.
let them do that. They will enjoy doing the messing up of all
Then
these
only they
things.
learn
Yeah.
how to do it,
Yeah,
actually.
right.
Things will come up to them, and then they'll learn things, how to do it, and then slow and steadily they have to have patience. Especially the mothers will have to have a lot of patience while dealing with their kids, isn't it?
Yeah, and every types of food should be introduced, but in a very slow way. And one thing should be always remember, that if the food is giving any kind of problem, you please come to the doctor and ask that maybe particular food may have some allergic problem to that child.
True, true. So Tina, on last note, what would you like to tell to the viewers out there?
I would like to add up that you should give the child a proper nutrition. At this, when you start, today we have, as we talked about the children, maybe of like 6 months. Till 6 months you give an exclusive breastfeed, and after that you should, along with the breastfeeding, you should start giving the kitchen food. But the thing is that it should be very slow, and weaning should not be too late. You should start at a 6 month onwards, and then slowly, gradually and slowly you should increase the amount as the child age increases. And the mother should be very much patientful while you feed the child. It should not be anytime hurry burry.
Very true.
Yeah, hurry burry. And then after the age of like attending the age of 1 year, you can incorporate like some of the vegetables. Green leafy vegetables can also be incorporated. You can prepare some rotis and all that can be can be kept in a hot water. Make it softer, and then you can add some dal, and then you can feed it, because from the roti they will get the carb, and complex carb they will get, and from the dal they will get the the protein part
Protein
of
part out
yeah,
there.
and then grind the vegetables and grind or grate the vegetables, and you can give it. And sometimes you can make soup also, and juices from the carrot and beets, which are very rich in vitamin A and iron. They are also rich in iron. Basically this type of children we have seen anemic, mostly they come to our hospital with the problem of like low iron. So because
lots of variety, lots of nutrients.
yeah, right. Particularly we should remember at this particular age the iron should be plays a very crucial role. So you should give your child the iron rich foods. Also like dates are also very that can be boiled and mashed and can be added with the khichdi and porridges. That can also, because dates also are very rich in iron. That can be given. And when they start when they attain like 15 months and all, you can give like raisins also. Raisins are also very good source of iron. So particularly by giving such kind of foods, the anemia can be reduced. And Also, like in terms of vitamin A, as I told, all kinds of like colored vegetables. no?
Colored vegetables
Yeah.
can be included in the
Yeah,
nutrients.
included.
Okay.
Zinc plays a very important role. Squashes and boiled squashes and boiled pumpkin or pumpkin soup or pumpkin purees can be prepared at home, and that can be given to the child.
Okay.
Usually the child do not like pumpkin kind of things, and later on also they will have the habit of having, because pumpkins.
So one thing, Tina, like everything is that like we have to give a proper nutrients to the children out there, and the mothers have to be very patient, isn't it?
Yeah.
So thank you, Tina, for coming to our show. We are short of time because discussions are on, and we were like knowing to things should be known, and there are so many things to know about, like how to feed their children, and one should have a proper patience. Mothers too should have a proper patience, and if there are any confusions, you are there, and like doctors are there to clear out their confusions as well. So thank you, Tina, for coming to our show and giving us such valuable inputs. So that was Tina. She was telling us about the complementary feeding. One has to start it on a right time so that the proper nutrients can be reached out to your children out there. So on that note, we'll take a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. Well, viewers, if you have any questions, you can send us through WhatsApp, and our WhatsApp number is 76370 I'll repeat the number again, 76370 Well, viewers, cardiology is a branch of medicine dealing with disorders of the heart as well as parts of the circulatory system. So today we will take you to Hayat Super Speciality Hospital, which has shown 99% success rate in terms of procedure and 95% success in terms of mortality and cure rate. Let's take a look what the hospital has to offer.
With increasing pollution and increasing cardiac problems due to the same, cardiology department has been a very important department of health science. Cardiology is a branch of medicine dealing with disorders of heart as well as parts of the circulatory system. Today, we will take you to Hayat Super Speciality Hospital, which has shown 99% success rate in terms of procedure and 95% success in terms of mortality and cure rate.
Viewers, today here we are at the cardiology department of Hayat Hospital, and we have with us Dr. Chinmoy Majumdar, who is the chief consultant of the cardiac department of the hospital. So we'll directly go to the doctor. So doctor, what is cardiology, and what are the treatments that are done in this department?
In cardiology department, we cater to all kind of patient. Mostly we deal with very critical patients, heart attack patients, pacemakers, those who need pacemakers, heart failure patients, and related to any other cardiac problems like also congenital heart disease, holes in the heart, valvular heart diseases, hypertensive heart disease, all those kind of patients, they come to us. We have most of the facilities which are currently available in Guwahati. Though we are not dealing with pediatric cases, means very small kids, and radiofrequency ablation EP study. Those are the things which we are still not ventured, but rest of the things, those facilities are available here.
With a 24/7 cardiac surgery backup, the hospital provides undisrupted service to the cardiac patients of the region. Hayat Super Speciality can also facilitate their patients with world's smallest pacemaker, which however is found nowhere else in the entire Northeast India. This smallest pacemaker can be implanted directly into the heart, which leads to a safe pacemaker implantation without any infections and complications.
Are there any rare cases or any rare cases you have dealt with in the department of this hospital?
Yeah, we often do cases, regular cases as well as relatively rare cases. I won't say very rare cases. Not recently, around I think 6-7 months or almost 8 months back, we did one smallest pacemaker in the world, which was already being implanted elsewhere in India, but for the first time in Northeast, we implanted the pacemaker here in our hospital.
What are the benefit of that smallest pacemaker?
Benefits are that when we implant a pacemaker, it has two parts. One is pacemaker battery, another is leads. Leads are inside the heart. So we need to create a pocket, pacemaker pocket in the skin, and we have to put the battery in that pocket. So the complications are there, like pacemaker pocket infections and lead fracture and lead dysfunction. To avoid those things, we can implant the smallest pacemaker, which is implanted directly into the heart. So there is no need for any pocket creation or any leads. These are not required.
As a cardiac surgery is an important part of cardiology department, so this hospital is also equipped with a full-fledged cardiosurgery department with most modern and updated machines.
Basic things done in this side of the department.
Basically, it is cardiac surgeries only. Though it is a cardiothoracic vascular surgery, we are doing only most of the time cardiac surgeries only with 99% success rate. So bypass surgery is coronary artery disease. Whenever there is blocks, we do on pump or off pump cardiac surgeries. I mean bypass surgeries, and valve replacement, single valve replacement, double valve replacement, and valve repair also we do here. With this heart lung machine, this is called a heart lung machine. This during on pump like valve replacement or congenital heart disease, even sometimes on coronary artery bypass surgeries also we use these heart lung machines.
With fast delivery of ECG and ECHO reports, the department also has facility of treadmill test, which is a very practical and effective way to observe the cardiac problems and treat accordingly, and can offer you the best of cardiac treatment.
This is our treadmill test machine.
So how it actually runs, like if we can show our viewers how it all works.
So we just connect the ECGs to the chest of the patient and ask him to walk over the machine, and we do like this. Like this, we have to hold like this and to walk here. Once the patients feel some discomfort in the chest or chest pain or some changes in the ECGs, we have to stop like that.
We were here at Hayat Super Speciality Hospital in the cardiology department, and we have seen how and in which ways the hospital can serve you at its best. With camera person Binay, Pretty Pediatrician for Northeast Live.
All right, with this we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. So if you have any queries, please do let us know by emailing us at goodlifeanylife@gmail.com, or you can also WhatsApp us. Our WhatsApp number is flashed on the television screen. Stay healthy, stay fit, and keep watching Northeast Live. Goodbye.